checking facility policy and procedures and the patient's chart and hygiene. No.
Come in.
Close the door for privacy. Hi, my name is Alexandra. I'm a student nurse. Can you confirm your name and date of birth for me?
Miley R.A. 9/14/2010.
Okay, I'm going to do a physical exam on you, which is called a head to toe. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain, could you rate your pain?
0.
Okay. And have you gone to the bathroom today?
Yes, I peed earlier.
Okay. And here I would continue to observe the patient throughout the exam. And notice she's pleasant right now. Raise the bed and lower the rails. Okay. Can you tell me where you're at?
The hospital.
Do you know why you're here?
For surgery tomorrow.
And do you know what year it is?
2026.
I'm going to give you a phrase to remember, and I'm going to ask you the phrase at the end. It's going to be black shirt. I'll begin with vital. Okay, your blood pressure is 120/80. Temperature 98.6, respiration 17, oxygen 100, pulse 80. I would take height and weight as well. Okay, now I'll begin the examination. Inspecting the head, symmetry, palpating tenderness or masses, cleanliness, inspecting the ears for abnormalities, knee cerebellum buildup. I'm going to whisper phrase to you and need you to repeat it to me.
Yellow bear. Green flowers.
Now tell me when you can see my fingers.
No.
Okay, close your eyes and let me know where you feel the cotton ball.
Left cheek. Right cheek.
Okay. Keep your eyes closed and close one nostril. Tell me what you smell.
Peppermint.
The other one.
Citrus.
I do notice that she does wear glasses. Can you take your glasses off? Inspecting eyebrow hair distribution, eyelash hair distribution, the eyelids. Can you raise your eyebrows? Okay. Inspecting cornea and pupil. Just stare straight up. You pull your eyelids down. Inspecting cornea. Moisture. Okay. Palpate sinuses for any tenderness. Palpate the nose. Check for any septal deviation. Can you follow this pen with your eyes only? Okay, perfect. Can you smile? Brown. Okay. Inspecting the lips. Can you open your mouth? How would you check for gag reflex? And say ah. Inspecting for uvula motion and tonsils if the patient has some. Then inspecting tongue, oral mucosa, teeth, gums. Okay. Move your head against my hand. And then the other way, checking for JVD at the same time. Palpate the trachea or the neck for any swollen lymph nodes. Try to get my hands. Can you raise your arms to the side? Perfect. Inspecting the skin for any skin integrity issues, warm and dry, color appropriate for ethnicity, the legs as well. Inspecting the fingernail integrity. Cap refill less than 3 seconds. Skin trigger less than 1 second. You squeeze my fingers as hard as you can. Okay, strength equal bilaterally. Push up, down. Assess radial pulses equal to plus bilaterally. Do this with your fingers. No clubbing present. Moving on to lower extremities, as I said. skin color appropriate, warm and dry, no pitting, edema present, pedal pulses equal 2 plus bilaterally, inspecting toenail integrity, cap refill less than 3 seconds, push up against my hands, push down, and then raise your legs up again. Okay. Now I'm going to inspect your chest. Have you had any difficulty breathing, shortness of breath,
No.
cough?
No.
Okay. Heart sounds. Aortic, pulmonary, herbs, tricuspid, apical 1 minute. And I would go ahead and do 10 lung sounds 1, 2, 3, 4, 5, 7, 8, 9, 10. And it would be 12 on the back. Inspecting abdomen shape. Have you had, and she did say she peed earlier in the morning. Inspecting her body for any tubes drainage that I need to make sure they're patent. Have you had any nausea or vomiting, discomfort?
No.
Okay. Inspecting abdomen first. Then auscultate 1 minute in each quadrant, 5 for absent vowel sounds, and then palpate any pain or tendon. All right, perfect. I'm done with your examination. Can you repeat the phrase that I asked you earlier?
Black shirt.
Perfect. Do you have any questions for me?
No.
I would lower the bed, raise the rails, make sure the bed is locked. Give her a call light clean, make sure everything's clean in her bed, her linens. I would chart my findings. All right, I'll be back in an hour. If you need anything, just let me know. Hand hygiene. Do you want your door open or closed?
Closed.
All right, I'll see you in a little bit. Close the door. I'll compare my findings to see if anything has changed.